Bismillahirrahmanirrahim. This is the screencast for the lecture number 8, Neoplasia. And here in this lecture we are going to discuss about the nomenclatures and the characteristic feature of tumors. So what the outcome we expect from the students after this session is the students should be able to define neoplasia and list the types of neoplasia, and they can able to explain or elaborate the terminologies used in the nomenclature of tumors, and they can able to explain the characteristic feature of benign and malignant tumors, and they differentiate benign from the malignant neoplasm. So these are the things we expect the students will be able to do after this lecture. So neoplasia literally means new growth, and it is first defined by a person called Willis. He's a British oncologist, and the definition is the neoplasia is an abnormal mass of tissue, right? And the growth is exceeds and it is uncoordinated. It is not matched with the normal tissue and persist in the same excessive manner, which means they persist in the same excessive manner after the cessation of the stimuli, which means after the stimuli is stopped also the growth will continue. So this is the definition of neoplasia. So neoplasia are of two types, so it may be of benign or malignant. So benign tumors are localized, it cannot spread to other site, and they are removed by local surgery. The patient generally survives. Whereas malignant tumor are generally called as cancers. The characteristic feature of this tumor is they invade, they destroy the adjacent structures and spread to distant sites. That is called metastasis. So that is the one of the main reason for death in the malignant patient. So some cancers, some malignant lesions are less aggressive and they are treated successfully, but if they are diagnosed early. So early diagnosis is very important for malignant tumors. So now coming to the components of tumor, there are two components in the tumor. So they have a parenchyma, which is made up of tumor cells, and they have mesenchyma. They are the supportive structures for this tumor cells. They are non-neoplastic. They are not neoplastic. So they are like connective tissues, blood vessels, and the inflammatory cells, which give support to the parenchyma's component of the tumor, that is made up of neoplastic cells. Now coming to the nomenclature of benign tumors. So we put suffix "homa" for the benign tumors, and if it is of parenchymal origin, that is of epithelial origin, and they have a glandular pattern, it is called adenoma, and the neoplasm derived from glands. Whether they have a glandular pattern or the tumor derived from the gland, we call it as adenoma. For example, renal adenoma, which means it's a benign epithelial neoplasm arising from the renal tubule cells, and they are growing in a glandular pattern. So papillomas are benign tumor, and it is of epithelial neoplasm, and it can grow on any surface that produce microscopically or macroscopically. Macro means through the naked eye, macroscopically finger-like structures, finger-like fronds. So they are called papilloma. So polyp means a mass that projects above the mucosal surface, example gut or oral mucosa. So they macroscopically produce a visible finger-like structures, they are called polyp. So now the nomenclature for the mesenchymal origin of benign tumor. So if it is arising from the fibrous tissue, it is called fibroma. If it is from the cartilage tissue, it is called chondroma. If it is from the osteogenous tissue, it is called osteoma. And it can be of mixed, whether both the parenchymal and mesenchymal component both will be tumorous. So example, mixed tumor of salivary gland. They have epithelial structure along with cartilage and bone. So many structures are there. It is called pleomorphism, and it is called has epithelial structures. It is called adenoma. It is called pleomorphic adenoma. Another best example is mixed tumor of female breast. Okay, so it is fibroadenoma. They have mixture of glands, so it is called adenoma, and they also have loose connective fibrous tissue. It is called fibroma. So now coming to the misnomers. So actually misnomers means the tumor, they are not benign, but the terminology looks like a benign. So for example, teratoma, it is the tumor comes from the totipotent stem cell. It may be malignant or benign. So it is a, but they have oma like benign like nomenclature, but they could be malignant. And there are some tumors, example lymphoma, mesothelioma, melanoma, seminoma, they all have oma in the end, but remember they are not benign, they are malignant tumors. They are malignant tumors. Now coming to the non-tumorous condition which has oma in the end. So example hamartoma. Hamartoma are disorganized tissues, but they are benign appearing mass composed of cells foreign to that particular site. Example pulmonary chondroid hamartoma. So there are islands of disorganized cartilage and they are located in the lung. So it is called pulmonary chondroid hamartoma. So this is the teratoma, and you can see the bone and the teeth and hair structure, because it is arise from the totipotent stem cells. They can bring any tissue. So it is called teratoma. Now you are seeing a lung and it is having a cartilage here. So it is called pulmonary chondroid hamartoma. Okay. Now coming to the nomenclature of malignant tumor. So if the malignant tumor of epithelial origin, okay, so we put the in the end as a carcinoma. So if they have glandular pattern, it is called adenocarcinoma. Or if they have a malignant squamous cells, it is called squamous cell carcinoma. So if the malignant tumor of mesenchymal origin, they are called sarcomas. So if it is as composed of fibrous tissue, it is called fibrosarcoma. If they have chondrocytes, they are called chondrosarcoma. If they have osteocytes, they are called osteosarcoma. Now coming to the characteristic feature of neoplasm, and first terminology we are going to discuss is called differentiation. Differentiation means the extent to which the neoplastic parenchymal cells resemble the corresponding normal parenchymal cells both morphologically and functionally. So if they are 100% matching, they are called well differentiated and they are benign tumors. Benign tumors are most of the times well differentiated. Anaplasia means they have complete lack of differentiation, which means they are totally undifferentiated. So malignant tumors may be well differentiated, moderately differentiated or poorly differentiated, but if they are anaplastic, which means undifferentiated, we have to suspect malignancy because most of the malignant tumors are undifferentiated. So now coming to the morphological appearance of anaplastic cell. So first thing is they have a character called pleomorphism, which means they vary in size and shape of nucleus and cell. So it is called cellular pleomorphism and nuclear pleomorphism. And they have abnormal nuclear morphology. Normally the nuclear cytoplasmic ratio is 1:4 or 1:6. It will become 1:1, which means they have more nucleus and darker nucleus. So now coming to the mitosis, the anaplastic cells do abnormal cell division, which means they divide into 4-5 cells, and they also lost their polarity. So which means the orientation is lost. So they lose their normal polarity. So they also have tumor germ cells and necrosis. So now coming to the another feature called dysplasia. Dysplasia means disordered growth. So it mostly happens it principally happens in the epithelium, and it is characterized by loss in the uniformity of individual cells as well as loss in their architectural orientation. So this is the normal cervical epithelium, and you are seeing this is the basal cells, and these are the intermediate cells, and these are the superficial cells. So these are the superficial cells, intermediate cell and basal cell. What happens is the human papillomavirus infects the basal cell, and the basal cell increase in number, and it has to be in the basal side. See, now it is going to the intermediate cells area, and it is replacing them, and it is called dysplasia, and it is called mild dysplasia because only 1/3 of the thickness is involved. Then if the 2/3 of the thickness is involved, it is called moderate dysplasia, and complete thickness is involved, it is called severe dysplasia. When they start producing the anaplastic cells, then it is called carcinoma in situ. If they come out of the basement membrane, then it is called invasive carcinoma. So carcinoma in situ is very important, because when you find a lesion in carcinoma in situ, it is called pre-invasive neoplasm. So they have dysplastic changes, and it involves the entire thickness of the epithelium, but the lesion remains confined by the basement membrane. They will not come out of the basement membrane. They are well within the basement membrane. If the tumor cells breach, that is break the basement membrane, then the tumor is said to be invasive. So that is the invasive carcinoma. So now coming to the other characteristic features of the neoplasm. First, benign tumor, how they invade locally. So they grow as a cohesive expansive mass. So they form a fibrous capsule. The white area is a capsule. So they do not have a capacity to infiltrate or metastasize to the distant site or invade locally. So this is the characteristic feature of the benign tumor, which has local involvement. Now coming to the characteristic feature of the malignant tumor, they are infiltrative. See, the tumor is growing and involving the surrounding area. It is infiltrating. So, and they invade the tissue, and they destruct the surrounding tissue, and they develop metastasis. So this is the characteristic feature of malignant tumors. Now metastasis means is a tumor implant discontinue with the primary tumor, and it goes to the distant site. So tumor, it marks a tumor as a malignant. So if there is metastasis, it is a definite malignancy. There are some malignant tumor, they don't rarely metastasize. They are gliomas and basal cell carcinoma. So how they spread? They can spread directly into the body cavities. Example, pseudomyxoma, peritoneum, and they can spread through the lymphatics. Carcinomas spread through the lymphatic, and they can spread through the blood vessels. Sarcomas spread through the blood vessels. Most commonly, sarcoma spread to the blood vessels. So this ends the lecture.